Greetings to the Makah community. Today is Monday, April 27th, 2020. This is the Makah Tribal Council's COVID-19 Pandemic Response Update. My name is TJ Green, Chairman for the Makah Tribe, and this message is brought to you on behalf of the entire Makah Tribal Council, Vice Chairman Keith Johnson Sr., Treasurer Patrick DePoe, Councilman John Idas Sr., and Councilman George Chad Beauchop. Today we want to discuss a little bit about our shelter-in-place order. We're coming up towards the end of the month. The shelter-in-place is currently in effect through May 15th, and there's a lot of people wondering on when is that going to be over? When can we go back to life as we knew it, or somewhat more of a normal life? And the answer to that is partially we don't know. We don't know because this virus is still a threat. However, we are working on things that we can do to get people either back to work in a safe environment and get people back on the water and fishing in a safe manner that doesn't promote the spread of this disease. So that's the number one priority is preservation of life and taking care of our people's health and safety. That is what the council is focusing its decisions on. So, our shelter-in-place order is asking people to stay home and to leave only for essential activities. We need to continue doing that. It's working. It's already saved lives. We're real confident that that's the case. This disease and the transmission of this disease is uncertain. It is highly contagious. It's a highly contagious virus, and then the consequences of contracting the disease are often deadly, and that can affect both the people that are at higher risks, the elderly, people with compromised immune systems, people that might be going through cancer treatments and things of that nature. So think about those people that we have, because we have them all through the community. We have a very large elderly population. We have a lot of people that have different health issues, whether it's kidney function or lung disease, COPD, and things like that. There are a lot of people. So think about them and your family. Why are you staying home? You're staying home for those people, and it's difficult. So regarding our shelter-in-place order, there's some things that we need in place that we need the medical science community to figure out before we can lift that order. One of those things is a testing capability. We need to be able to test at much higher intervals. We don't have enough testing supplies yet to be able to put in a really good testing system to protect people. And one of those things about the tests is that right now they're only have an 85% sensitivity rate to them, and that's not real great. There's they need to be a little better, but they're just not right now. And hopefully there can be some science to develop a better test to better detect this virus, and then we can isolate and quarantine people as we detect the virus. So we need that to get better. Right now we're not there yet, and that's not a function of the tribal government. That's a function of medical science being able to develop the technology to do that. And so there's also antibody testing that's becoming available, but right now the medical science doesn't know whether having antibodies actually protects you from contracting the disease again. They're still studying that. That is not known. It's not certain that you develop immunity, and without that immunity, we can't depend on an antibody test either. And so, and those are not readily available. There's not a huge supply of those out there to the populations throughout the U.S. Right now, there are over 55,000 deaths in the United States from the COVID-19 disease. There's over 738 deaths in Washington, and so it's still a threat. Things are still getting worse in some areas. And that's hard for us to wrap our minds around because we have no cases here in Neah Bay, and there's very limited cases in Clallam County, only about 14. And so it can give us a false sense of security, and we need to be careful that we don't embrace on a false sense of security that we are safe because we haven't seen the virus out here yet. There's very good likelihood that the virus is present in these areas. Testing has just been low. For example, we've only tested around 22 people in Nia Bay, and we have over 1,700 that live in our community and surrounding area that could possibly be tested. And so those are those are the risks that are out there. With low testing, you can't have a high degree of confidence that the virus is not in your community. Also in Clallam County, I think only about 1.8% of the population has been tested in Clallam County. That's a very small percentage. There's not enough of it going on yet. So as supplies become more readily available and hopefully testing gets better and the sensitivity to it gets better, then we can start relaxing some of these shelter-in-place restrictions when those start happening. Of course, another thing that could happen is if medical science can produce a vaccine for people, that would be really great. And then we'd have to vaccinate people. We'd have to get over 50% of our population vaccinated, and then we could start relaxing these shelter-in-place restrictions that we have. And then, of course, highly effective treatment would be really ideal. People are still dying from this disease when they contract it, and that's why we're being cautious, because human life is first and foremost. That is the council's priority, is to protect human life, and everything after that comes secondary. And we're gonna discuss some of the financial things as well today, but let me just wrap up on the health side of it, is that there just isn't the medical science, and the technology is not there yet, the testing capabilities, there's no vaccine, and there's not an effective treatment. If you contract the disease, they don't have a surefire way, a real good way to protect you from getting severely ill and possibly losing your life. And so until those things are in place, we have to have some sort of shelter-in-place order. We have to have social distancing. This is likely to go on for several months, and we need to start preparing for that. We are looking at ways to how we can get people back to work, like I said, and also back on the water and fishing. We're working with our health professionals, and we will be developing some recommendations to put forward on how our fishermen can isolate themselves, can protect themselves on a vessel, and then when they leave the vessel and go back to their families, that they can do some things where they're not a risk to their families, because we don't know who may or may not have the virus inside their bodies. So with that being said, I do want to talk about the fishermen right now. I mean, this is a big week. We're supposed to be heading out fishing. We're supposed to be getting on the water and going halibut fishing. That's who Makah is. That's a big part of our income for the community, and we're not going to be able to do that. We're not going to be able to do that just yet. And it's probably going to be a few weeks until we are able to get on the water and do it safely. The salmon fishery that's coming up on May 1st, that will not happen on May 1st as well. Like I said, we're still trying to figure out how we can do that safely. Salmon may be a little bit easier than halibut, because some of the salmon fishing, you have as little as 2 people on a vessel to go out there and do some of that. 2 to 3 people when you're salmon fishing. Halibut can be much more. Some are as high as a crew of 6 that are on a halibut vessel. So we got to think about those things and try to come up with plans to do that safely. We welcome suggestions from our fishing community, but we can't just go out there and do these activities like we've done in the past. We have to do them differently. We have to do them safely to protect the life of our people, and that's what's most important. There is some small relief that is available through the state unemployment system, that you can apply for pandemic unemployment assistance, and you can do that. You can use a computer at the tech center. Hazel Secor's been helping some people get through that process. It is a bit cumbersome. I ask your patience for going through that. I know you're not used to having to go through those sort of forms and answer all these different questions online, and it takes a while to get through. But once you get through it, There is a little bit of relief. You'll be able to get a few $100s a week. It might be different for everyone. I can't say exactly how much that is, but it depends on your earnings. So just be patient going through that process, and then once you get your filings in, make sure that you file weekly. You have to file weekly and file on time, so you don't have any disruption in that pandemic unemployment assistance that you qualify for. So you have any questions, you'll get a hold of someone at the tech center. Maybe they can put you in touch with Russ Savek or Ray Colby or Tiffany Peterson or Jackie Johnson. That you'll need to fill out these forms. Deckhands need to fill out a form for income verification. Boat owners need to fill out a form for income verification, and we're trying to provide as much assistance there as we can to get you through that. We also have, with the food bank, there's a lot more people using the food bank now. We're going to be pouring more efforts in terms of supplies, and we'll look at staffing there as well to try to get people through there quicker. There were long lines at the food bank on Friday, and we did take account of that and are going to try to make that process better for the community. But until then, I certainly ask your patience when you're using that service. We know that it's I think some of you might have been waiting there almost 2 hours, and so we're going to improve on that. We'll get better, and apologize for that wait, and we'll work to improve that system for sure, so that we know that's much needed, and we don't want to take that much time out of your day to go and get your essential nutritional needs at the food banks. I want to make mention of the the council, some of the work that the council's doing. That legislatively, we're working to push really hard for the disaster assistance through the CARES Act that was recently passed. There is money that will be coming to the community. We don't have information on timing and how much yet, but we do have our system in place so that when that federal money is received, we'll get that out to the fishermen. We're certainly tracking all the additional legislation that is coming through. The tribal organization, has taken a hit from its revenues as well, so we're taking a look at our own budgets. We'll be going through a process of revising budgets, reducing budgets, so that we are fiscally responsible with the people's money, and that we can have resources available for those who are most in need. And so, we're in the process of doing that. I know it can't happen fast enough for some people, but we are definitely working on it, and we will provide additional assistance to the community through these processes. So we've been at this, March 16th. We started this order, and so it's been about a month and a half. A month and a half we've been working hard to protect the lives of people, and now we're feeling the pains of what that's caused now. Having everything in place before we do it is just not possible in a public health crisis. I want people to understand that. A lot of these things were very fluid. It was very dynamic at the beginning, and we had to play some catch up, and we still are in a lot of areas. And that's because the medical science can't tell us things for certain. We want certainty, and right now there is not certainty in how we protect the lives of people, other than sheltering in place, staying home, staying safe, washing your hands, sanitizing, and doing those things is the only thing that we know can protect us right now. So as we develop those plans a little better, then we'll be able to move into doing some of the things we're used to doing. But until then, I ask your patience. I ask for your perseverance. Let's persevere through this as our ancestors did, and that's why we're here today. And that's what we need to do for our future generations, as I mentioned in an earlier update. And that's important. And I know it's hard right now because the financial needs are growing, and we're going to work to help out with those financial needs. I ask your patience and certainly welcome your suggestions. With that, I want the Makah community to know that the council is thinking about you all the time. We have your needs on our heart, and you're important to the work that we do. With that, have a great week. Have a great day. Klako. Shoo.